It's been a slow news week with respect to healthcare reform, but that doesn't mean it's been a no news week. This is Healthcare Triage News. On the exchanges, people can choose between bronze, silver, and gold plans. These differ in the amount of money that individuals have to pay for care versus what insurance companies pay. Another word for that is actuarial value. A gold plan has an actuarial value of 80%, meaning that the insurance company pays for 80% of the cost of care and you pay 20%. Bronze plans, on the other hand, have an actuarial value of 60%, meaning you pay for 40% of care through higher deductibles. Silver plans come in at 70%, in between. The 30% that you're responsible for comes in at a deductible of about $3,600 in 2017. But that's a lot of money for people making just above the poverty line. So, for people making between 100% and 250% of that line, they also get help with their cost sharing. For people who make between 100% and 150% of the poverty line, actuarial value is raised to about 94%, leaving them with a deductible of about $300. From 150 to 200% of the poverty line, it's 87%, or a deductible of about $800. And for 200% to 250%, 73% actuarial value for a deductible of $2,900. The way this assistance is rendered is that insurance companies receive direct payments from the government to cover the difference. They get those payments based on the number of enrollees they have in each category. If they don't get the payments, then they'd need to charge everyone more to make up for the difference. That's because they'd still be required by law to cut the poor a break, but wouldn't be reimbursed by the government for doing so, so they'd need to take it from other beneficiaries directly. Last week, we talked about how President Trump could halt the cost-sharing reduction payments. This week, the CBO told us what would happen if he did. Let's wade in. First of all, CBO expects that insurers would exit the market in a number of areas around the country. Therefore, the percent of people living in areas with no insurers offering plans would likely go up for the next 2 years, leveling off by around 2020. The premiums for silver plans in 2018 would go up by 20%. By 2020, they'd be up 25%. But because tax credits are pegged to premiums, that would mean the cost to taxpayers would also go up, even if you weren't buying a plan on the exchanges. In effect, the federal government would save about $118 billion in the cost-sharing reduction payments directly over a decade, but they'd spend more than $360 billion more in premium subsidies. This means that the federal deficit would increase, up $6 billion in 2018, $21 billion in 2020, and $26 billion in 2026 alone. Over the decade, the deficit would balloon $194 billion. Oh, and the number of people who would be uninsured would go up in 2018. The good news, and it's not much, is that starting in 2020, the number of uninsured might go down a bit. Why? Because premium tax credits would have gone up so much that some people would find it more attractive to buy insurance there than through their employer, which might decrease the number of uninsured overall, but further weaken the employer-based health insurance market. As with everything in healthcare reform, there are trade-offs. We'd get a slight reduction in the uninsured, but only because we were spending much more through the federal government. We'd also see an overall increase in premiums, but again, the federal government would be covering much of that cost.